It seems that acid reflux has minimal effect on our health. But do you know that acid reflux could result in esophagus cancer in long run? I want to give you some information about this medical issue and how we can handle the situation. When the content of your stomach back into the esophagus, it called acid reflux. As the opening to your stomach, there is a valve, which is a ring of muscle called the lower esophageal sphincter or ileus. Normally, the ileus closes as soon as food passes through it. The acid produced by your stomach can move up into your esophagus if the ileus doesn't close all the way or if it is open too often. As the acid content of the stomach bag, it irritates your esophagus. It causes gastroesophageal reflux disease or GERD. This causes painful burning in your chest called heartburn or acid indigestion. In general, about 20% of Americans are affected by GERD. Heartburn and vomiting are the main clinical symptoms. Some other symptoms of GERD include nausea, burping, sore throat, pain when swallowing, difficulty swallowing, chronic cough, hoarseness, bad breath, and bringing food back up called regurgitation. Now we can talk about the cause of acid reflux. HIATAL hernia, a condition when the upper part of your stomach moves up through an opening in your diaphragm. In a normal situation, the diaphragm helps keep acid in your stomach. But if you have a hiatal hernia, acid can move up into your esophagus and cause symptoms of acid reflux. Obesity is one of the most common reasons for acid reflux. The other one is pregnancy. Living with a connective tissue disease such as rheumatoid arthritis or scleroderma. Smoking is one of the most common causes of reflux disease. Anxiety could cause acid reflux. Some medications, such as those that treat allergy, high blood pressure, and depression, may result in acid reflux. Now the question is, what are the complications of acid reflux? If the GERD leaves untreated, causes a narrowing of esophagus or esophagus strictures. Damage to the lower esophagus from stomach acid causes scar tissue to form. The scar tissue narrows the food pathway, leading to problems with swallowing. GERD may cause you to breathe stomach acid into your lungs, resulting in respiratory problems such as asthma, hoarseness, wheezing, pneumonia, and laryngitis or inflammation in your larynx. GERD may result in an open sore in the esophagus or esophageal ulcer. Stomach acid can wear away tissue in the esophagus, causing an open sore to form. An esophageal ulcer can bleed, cause pain, and make swallowing difficult. GERD can also cause a condition called Barrett's esophagus. Damage from acid can cause changes in the tissue lining the lower esophagus. These changes are associated with an increased risk of esophageal cancer. Avoiding or limiting the following foods can improve the situation: fatty or fried foods, beans and lentils, oranges, grapefruit, limes, pineapple, tomatoes, tomato sauce or foods that use it such as pizza and chili, salsa, chocolate, onion and garlic, coffee, tea and alcohol, drinking certain beverages such as carbonated drinks and soda, using plenty of non-steroidal anti-inflammatory medication like aspirin or ibuprofen or blood pressure medications. Using alcohol in large amount put you at least. Lifestyle changes for improving acid reflux includes first, losing weight. If you are obese, is a good strategy for lowering the risk of GERD. Eat a small portion of meals and at least 3 hours before night sleep. To avoid pressure on your abdomen, wear losing fitting clothes. Walking after eating may help move food through your digestive tract. Avoid smoking. Raise the head of your bed 6 to 8 inches when you are sleeping. In most cases, acid reflux can improve by diet and lifestyle. If acid reflux didn't improve, you should visit your doctor. Okay guys, we enter the end of the discussion. If you have any question, leave a comment below. Make sure to like and subscribe so you could be able to watch my future videos. Thank you for watching and being careful about your health.